Hello, my name is Sean Therese Biles,
My name is Frederick Higgins.
and we're doing a presentation on a cure for cancer. So in our case study, there are a couple of students at a university sitting around the table, and one of the characters is named Miranda, and she is sad because she just found out that her mother was diagnosed with breast cancer, and her classmate Devin is trying to console her, and is basically trying to reason with her like how it happened and why it happened to her, and basically questioning her about the area that she lived in, and asking Miranda what happened and everything. But another student, Roxana, she comes in with a different mindset and is telling them that researchers already have a cure for cancer, and her mother is just another patient who the medical system will be getting money from. And so Miranda is left with feeling defeated and wondering where she stands at in the position since her mom was diagnosed with breast cancer.
Okay, so there are a few conspiracy theories that float around the world or realm of cancer. So there's the theory that there's already a cure for cancer. There's the theory that it is more profitable for the medical field or medical system to actually treat cancer rather than cure it, and that wealth gives you greater access to more efficient treatment. So here's a picture of Dr. Sebi, who is a holistic doctor that has allegedly cured cancer by changing the diets of patients that were diagnosed with cancer by introducing them to like an extreme vegan diet. He was able to reduce the inflammation and mucus buildup inside the body, which causes an increase in cell count. So with this change of diet, he was able to help cure or reverse certain diseases that are formed in the body. Here is a celebrity or a former athlete, Lance Armstrong. He was a professional cyclist for many years. And Lance Armstrong, as you can see in this blurb right here, he was diagnosed with an aggressive form of testicular cancer that then transferred into his abdomen, to his lungs and his lymph nodes, and then into his brain. But due to his access to his wealth and his stature itself, being one of the faces of the sports company Nike, he was able to get access to extremely good cancer treatment. So he was diagnosed in October of 1996, and after surgery and aggressive treatments for his cancer, he was then cancer-free by February of 1997, which is approximately 4 months. So he was able to be diagnosed and get the proper treatment and be cancer-free in 4 months, which is not normal for casual, everyday pedestrians.
Okay, so in the case study, Devin stated that he saw in the news that there was an unusual high rate of cancer over in Clyde, and that is where Miranda lived. And so she was concerned about her risk for cancer. And when I was doing research, breast cancer and the environment, there was no correlation, but some environmental factors did correlate to other forms of cancer, and those risk factors are toxins in the air, toxins in the water, area with high tobacco exposure, areas with poor access to health care, limited access to food, quality of medical care, higher elevation, and exposure to high amounts of ultraviolet rays. And although higher elevation is a risk factor, just because you live in a lower elevated area, that does not exempt you from being at risk for cancer as well, because when I was doing my research, they said it was really in the UV count. That's what really affects whether or not you have a higher risk of cancer, is your exposure to the UV rays.
So here it talks about the cost for treatments rather than the cost of a cure for cancer. So in 2018, you can see that $150.8 billion was spent on cancer care itself. And on average, a person will spend approximately $10,000 on a single medication in a year. And that right here it says 11 out of 12 drugs that are FDA approved for cancer are approximately priced above $100,000 a year. And on this chart right here, you can see that lung cancer being the highest grossing cancer for treatments in a year, which is approximately $282,000 per year, or for the treatment of that cancer itself. And the lowest one being melanoma, which is the most common, being at $48,000 to treat that cancer itself.
So, 1 in 8 women in the United States will develop breast cancer in their lifetime, and that's pretty high. And when looking at these charts, you can see that on the left, that's the incidence of women in the United States who have gotten breast cancer in the year 2012 through 2016. And as you can see, Caucasian and African Americans had a high incidence rate in comparison to other races, but the other races still have a high level of breast cancer. And in the graph on the right, you can see the mortality rates. And although Caucasians was number 1 in incidence rates, they are not number 1 in mortality rates. And number 1 happens to be the African American race. And this is so because in doing research, it was noted that African Americans, when they're diagnosed, they often go in late stages when the cancer has spread into other parts and gotten worse. And genetics and risk factors. So Miranda, she was wondering if she was at risk because her mom got it. Unfortunately, with her mom having it and that being a close relative, that does put her at a higher risk of developing breast cancer. And also, mutations of the BRCA1 and 2 genes also increase the likelihood of developing breast cancer. And here in this brochure, you can see that relatives who are a lot closer to you, that increases your chance. And the more relatives that you do have, that also increases your chance even more. So with her mom being such a close relative, that does put her at a high risk. So unfortunately, Miranda should take, the necessary precautions to catch her breast cancer earlier on, or even try to prevent it. Okay, so to end our presentation, we thought it would be interesting if we included our stand on if we believe if there's a cure for cancer or not. So me personally, I don't think there's a cure for cancer, but I do think that there are better treatments than others. And I just think it depends on your social standing, on if you can afford those treatments or not. And unfortunately, some people do receive better treatments than others.
Well, me personally, I do believe that there is a cure for cancer. In 2004, there was a patent that was applied for a cure for cancer. And as you can see, the cancer business or the medical field and cancer itself actually generates so much money. In 2018, it generated $150 billion. So with it being able to generate so much money, I feel like it wouldn't be as profitable or as beneficial for the medical world to put out a cure that would then put an end to the cash flow, the annual cash flow of the cancer business, because there's a breast cancer awareness month. There are all these cancer awareness months that people donate to so frequently, and it's such a money-making business that it wouldn't be profitable for them to put out a cure, which would then end their cash flow.
And her references. And that concludes our presentation.